My name is Owen Ossenden. I'm a consultant physician and the director of the North Wales Clinical Research Facility, a dedicated unit specialising in the delivery of early phase clinical trials of experimental drugs. Following large-scale successful phase 2 and 3 studies, I've developed capacity to deliver first-in-human clinical trials in North Wales. These trials are being undertaken in humans for the first time ever and bring higher risk than most other trials. How did we do it? In order to achieve this, I set up the North Wales Experimental Medicines Group, a first ever in Wales. The MHRA regards an experimental medicines group as a vital component for first-in-human research governance in order to deliver research safely for patients and participants. Why is this important? Very few first-in-human studies have ever been undertaken in Wales, and none outside of Cardiff. This has allowed us to undertake the first-in-human Empower study, a vaccine which has to date been shown to be safe and efficacious against a virus that was declared a global public health emergency after it caused an outbreak in over 110 countries in 2023. How about the future? We're now looking to attract more first-in-human studies to Wales and expand early phase capacity in line with Wales's response to the O'Shaughnessy report. Furthermore, our experimental medicines group can deliver research governance across Wales and bring more first-in-human studies to other sites in Wales. Thank you.